It's my pleasure to welcome you to the 19th session of the International IVF Initiative, or I3. I'm really very honored and excited to be co-hosting this 19th session of this initiative with Professor Kersti Lundin from Sweden, who was one of the previous chairs of ESHRE not too long ago, I think from 2016 or 2015 to 2017. Hello, Kersti. Good to have you with us. I hope all is well in Sweden.
Hi, Jacques. Yes, everything fine here. Even the weather, which is unusual.
It's amazing. Yeah, it looks sunny through you. I can see it. It looks very sunny.
Yeah. It's amazing. We have like 26 degrees, only for a couple of days though. So
fantastic. That's centigrade for those of you in America.
Yes.
So that's about 80 or so, right? It's about 80. So Kersti is in Gothenburg in Sweden. It's a large town, large city. It has the largest shopping mall in Sweden and the world's largest cinnamon buns and a lot of other things, okay?
Very true.
A lot of other things as well. Now I'm in a little town, a very little town. We would call it a village in Europe, in the village of Hudson in upstate New York. And the locals here are very relaxed and occasionally stroll along its only street. My name is Jacques Cohen. You can check Kersti's bio and my own bio and our disclosures on the website under today's meeting. So over to you, Kersti.
Thank you so much, Jacques, and thanks for having me here as well. And I know that both you and me, we are very thrilled and so pleased to introduce to everybody today's special interview with two of the greatest women in IVF. So we have with us today Professor Catherine Racowsky from Brigham and Women's Hospital of Harvard University, who is the current president of ASRM. And she's talking to us from her home in Boston. That's the way we do it these days. And then we have Dr. Cristina Magli, who is the current chair of ESHRE. And she's meeting with us from her home in wonderful Bologna, Italy. Very welcome to both of you. And I have to say, you are a truly special pair. This is the first ever happening to have two women, both being scientists, both being embryologists, and both being at the same time in charge of the two largest professional organizations in our field. That is really amazing. And if anyone in the audience, I'm sure you do, wants to know more, Catherine and Christine's bios are also available on the I3 website. In preparation for this webinar, Jacques and I have had separate interviews with both Catherine and Cristina. And we would like to start this webinar by first showing you some extracts of those two interviews. They were really fantastic talks with two very enthusiastic and quite talkative ladies. So you will notice some cuts and breaks in order to keep the total timeline to 30 minutes. But again, all recordings will be posted on this site by tomorrow morning in Europe or this evening in North America. And you will be able to see both the director's cut versions and the total extended interviews as well. Recording and editing were performed by Thomas Elliott. Thank you so much, Thomas, for all your work. After showing these recordings, then we will have a live discussion with, we call them here CNC, Catherine and Cristina. And we are inviting all of you to please ask questions. You now have the one and special chance to find out everything about this fantastic pair of women, their jobs and the organizations that they represent. I just want to say that you have to know that all questions have to be asked through the Q&As feature on Zoom. So please do not use the chat function for questions. Submitted questions will be answered either directly online by the speakers now or in writing by them later today or after the session. And all the answers will also be posted on website. Like this interviews, these current sessions will be recorded and later be available via a link on this site. So for now, please sit back, relax, and enjoy.
Well, it's very good to have you with us today, Catherine. Thank you for taking our time. I know you're incredibly busy. You're probably making some preparations to go back to work, and it's complicated in our field. And then you are president of ASRM. You're an embryologist, lab director, it's quite an incredible combination of things, particularly in this time. And we are so grateful that you are our leader, and that has shown in the last few months. But let's take it easy for a little bit, and maybe first you can talk about where you come from. When did this all start for you? Where did you study?
Absolutely, Jacques. Before I respond to you, I really would like to thank you and your team for inviting me to participate in this video. I'm really honored and humbled to be here. So where on earth did it all start? Well, it started way back when I was a PhD student in Cambridge with Brian Heap, where I was studying embryos. And then at that time, of course, Septo and Edwards were really trying to develop IVF, clinical IVF. And I would occasionally go to the Department of Physiology in Cambridge to listen to Bob Edwards on a Friday. He gave Friday lunchtime seminars about clinical IVF and his progress. And this was in the early to mid 70s. Now I'm going to date myself. But it was just really exciting to listen to him explain and discuss the challenges that they were facing. And I'll never forget the one occasion when he basically said, I am not sure this is ever going to work. Of course, you knew Bob very well, Jacques. And so you knew that, he had this amazing black hair, really thick black hair. And I remember him running his fingers through his hair, and making his appearance look like Einstein. And he just stood there in front of all we students saying, I'm not sure this is going to work. And it was a really profound moment for me. I was at the time working actually on pig embryos and studying implantation. But the fact that this eminent, obviously incredibly capable man felt that this may be a challenge that he's taken on that he may not be able to meet was, I think, a moment of realization to me that you just stick at it. And I carried that with me actually through my career, that moment when he said that.
Yeah.
So fast forward from then, I then ended up at Harvard as a postdoc, initially with Koji Yoshinaga and then with John Biggers. Most of the time it was with John Biggers. And as you know, he was English, and we English have a very special bond, I think. I was very sad to leave his lab, but I left his lab as a result of a man who carried me off to Arizona. And so I was in Arizona then for several years, actually many years, if I had to count them, close to 15, 16 years, I think. Initially at Arizona State University and then at the University of Arizona. So at Arizona State University, towards the end of my time there, I succumbed to infertility. And I actually had 5 years of infertility and went through 2 GIST procedures and finally conceived with intrauterine insemination. It's low-dose Pergonal, IUI, and conceived with triplets. And this was like a game-changing moment for me, obviously. Having gone through 5 years of infertility and then finally to be at the point where I actually was pregnant was absolutely amazing. And I did not care that I had 3. In fact, I was elated. And so it was shortly, I guess, I don't know, several months into the pregnancy when I realized that with my basic science training and the fact that I had had infertility, that it was a natural segue for me to be a clinical ART lab director.
And so how did you go from that to, you went back to Harvard, you went back to the Northeast, and obviously John Biggers played a big role and a draw, I'm sure. How did that come about? The job became available, or Brigham and Women's?
So what happened was at the time, this we're now talking 1996, late 1996. In fact, it was the ASRM meeting of 1996. I was fortunate enough to win the SART Prize Paper Award. And in the audience was my previous division chief. And I think, I'm not exactly sure, but my understanding is there was some discussion between John Biggers and my previous division chief that I should be brought back to Harvard as the IVF lab director.
Oh, there you go. Yeah, obviously.
So this was, it was probably, I'm talking maybe late November, early December of 1996. My telephone started to ring in my office. And I spoke to him several times. I would guess probably half a dozen times before I agreed to go to interview. And the reason why it was so difficult for me to make that decision was because I'd really put my heart and soul into the program at the University of Arizona. There was just myself and one other young lady who was helping me. I ran the hormone lab and the IVF lab. We were doing over 200 cycles a year, and it was literally just myself and Teresa. And it was a really, you were there. It was such an exciting time in our field. There was so much we didn't know, and we were groundbreaking. And just the thrill of the chase every day, as it were, to get fertilization and to examine the embryos, understand everybody that at that time there was no training in clinical IVF at all. So when Jean-Pierre Palermo published his first paper on ICSI, which I believe it came out in 1992, if I remember correctly, I was absolutely thunderstruck by that paper. And I decided that I was going to establish ICSI at the University of Arizona. And unfortunately, I met with a fair amount of resistance there. It was basically thought that it would never work, in inverted commas, and that I'd be wasting my time. And I was doing Susie before that, as probably you were as well, with a really high incidence of triploidy rate and very low diploidy rate, and it was very frustrating. So the resistance was so severe that I was basically told that the university or the department would not fund me to go to Belgium to take one of the courses. So I said, darn it, I'm going to go myself. So I paid my own way for the course and for my fare, and I used vacation time, and I went there and I took, I think it was their second course. Yes. And I remember writing my protocols when I went back to my B&B at night, and then returning to Arizona going, oh God, now I've really got to do this. And so, I had no equipment at all. So I bought a tungsten wheel, to grind the needles, to bevel them. And I managed to find in the Department of Anatomy in a closet a microscope with a sufficiently large clearance so that I could make some sort of a microforge. So it took me a day to make sufficient holding pipettes and injection pipettes for one case. And it was really tricky. I remember, with my tungsten wheel, I had a protractor to get the angle of the bevel right. I mean, this was really all incredibly.
People don't realize that, the embryologists nowadays don't realize that it's only been 20, 25 years since you can buy these things.
Exactly. And but it was, although it was extremely challenging, it was so exciting and so satisfying. And I was particularly satisfied because my very first ICSI patient conceived. Yeah. And I'll never forget, of course, I made a complete idiot of myself, but I tend to be a little bit like that. So they arrived after the baby had been born. They arrived in the waiting room and they wanted to see me. And I went and I saw this little boy who looked the spitting image of the father. And of course, I just burst into tears in front of all these patients. I was so excited. It was just such a sense of accomplishment when I'd been given no encouragement whatsoever to get this program started. And we basically became the male factor center for the Southwest in those days, right?
So how do you go from there? So you're back in Harvard, and then
so I go for the interview, and I remember when I was getting on the plane, flying from Tucson to Boston, going, well, this is going to be a big turning point in my life. I mean, I made the decision to go for the interview. I really loved my time at Harvard, and having made that decision to go for the interview, I realized that this was probably going to be it. And so I went for the interview in the January of 1997, and in April of 1997, I was on board as the lab director. Yeah, so the first day I was on the job, I'm summoned into my division chief's office, and he said to me, and these were very wise words, which I just like the Bob Edwards words. He said, you have these phrases in life that you're delivered. What my previous division chief said to me, he said, now, Catherine, he said, I want you to understand that in Arizona, you were a very big fish in a very small pond. You're now one Arabian horse amongst many in a very large stable. And I crept out of that office, feeling like the size of an ant.
It's so true, yeah.
So I think one of my sort of key contributions to the clinical field was some of the work that I did with John Biggers after I'd returned to Harvard as the clinical IVF lab director. And of course, this relates to all the incredible work he did on KSOM and the culture media that he developed in his lab for supporting mouse embryo development right the way through from the one cell through to the blastocyst stage. And so at that time, of course, David Gardner had developed his two-step medium. And I was having lunch with John on the Harvard Quad one day, and I was telling him about this two-step media and how, you know, it just seemed odd that an embryo would actually have to adapt to a different media just at the time when the embryonic genome was being activated. And so John and I just chatted about it. He said, well, you know, Catherine, I've just, you know, I've got this media that my lab's been developing, which, you know, is incredible at supporting mass embryo development. Why don't we try it in the human? So we set about, you know, designing an experiment on a napkin, as one does. And, you know, within short order, we'd actually tested whether caisson as the second stage media actually was capable of supporting a human embryo development right the way through. So that was, you know, for me, that was just such a pleasure to be working with him again. I stayed in extraordinarily close contact with him all throughout the time that after I'd returned to Harvard. He was one of my best friends, actually.
So if we then move forward just a few years, because I think you probably have been involved with ASRM and organization of ASRM for probably about 15 years or so. I don't know if I'm getting that right, but
yeah, you actually are just about right, I think.
Yeah, must have been quite a long time. So it's not that you can apply for the job you have now at ASRM, right? There's no advertisement in the newspaper. Presidents want it, right? So you have to evolve to become president of ASRM or chairperson of ESHRE. This is not a process that is given to you. And if you have 300 publications or 150 or 10, it makes no difference. It all depends on what you do before. So how did you do it? How did it happen for you? It's a long process.
Yeah, it certainly was a long process. Yeah, I very much believe in organizations like the ASRM. I think that just having groups of people and sharing ideas is you're so much stronger a person, not just as a researcher, an embryologist, but just as an individual if you share ideas. So I was interested very early on in becoming a member of the ASRM, although I will say, just as an aside, having been a member of SSR and going to those meetings in t-shirts and a pair of shorts, the night before the first ASRM meeting I went to, I had none of the appropriate garb and I had to fly off and buy a suit. That is literally, I had jeans and t-shirts. But so I got involved fairly early on. I think I was very fortunate, frankly, Jacques, because there weren't very many of us, if I may explain that, people who had a very rigorous training in basic reproductive physiologists who then became lab directors. And so we were a fairly sort of small group of people, I think. And as a result of that, if you were doing research as well, which of course I was, then you immediately start getting noticed because you're presenting your work. And I presented my work a lot at ASRM meetings, you know, both in oral and poster form, on all sorts of different things, ranging from, I don't know, human eggs from oophorectomy specimens to the effect of nicotine and caffeine on embryo development in the mouse or the rat. So I got sort of established as somebody who was, you know, not just a lab director, but someone who really had this underpinning of basic biology behind her, but also this incredible drive just to keep moving the field forward. Yes. And so I was invited to become a member of the practice committee. That was a little bit later on, but I think the very first sort of thing that got me on the way to becoming president of the ASRM was I was asked to become secretary. Right. But I was secretary, I believe in 2006 was my first year as secretary.
Oh, yeah, okay.
So, you know, it was a long time ago. And then from there, I was asked to join the presidential chain of the ASRM, which was just an incredible honor. It was a little bit daunting. I'm only the second PhD who's president of the ASRM, and I'm the first clinical embryologist. So it's a big responsibility for lots of different reasons.
Yeah. Yeah. And so the coincidence, or maybe it isn't a coincidence, of course, is that Cristina Magli has a similar background and is also in that role now in ESHRE. And that's what's driven us to get the two of you together. Okay, that was great talking to you. I'm very excited about this interview. Hopefully it was all recorded.
I'm very honored to present Cristina Magli from Bologna, embryologist, lab director, and the current chairperson of ESHRE, European Society of Human Reproduction and Embryology, and also to me, a friend or colleague for many years now. So Cristina, thank you so much for accepting to participate in this webinar. I would really like to tell me, everything from the beginning to the end, or to where we are now. And starting a bit about, how did you come to be an embryologist? Was it by chance, or was it sort of something you had a focus on from early on? And how did you come to work in Bologna?
Well, I am from Bologna, so
Yes.
this is my city, actually. How come that I became an embryologist? Well, totally by chance, because it was an ad in the newspaper many, many years ago. The point was that when I graduated in biological science here in Bologna, soon after that, I got married. You know my husband.
Yes.
He's a civil engineer, and actually he was born in Venezuela from Italian parents. So his genes are actually Italian, but nevertheless, we decided to go there because he had a working commitment over there. And Venezuela at that time, I'm talking about the 80s, early 80s. It was a very nice country where to live. It was a fantastic country. Then over there, I started working in the Venezuelan Institute for research, and I was involved in immunology. Immunology at that time was a real top area where everybody was so much interested in immune response and trying to understand how HLA antigens predisposed to in some sort of diseases or potentiate the immune response. So and there I did a lot of molecular biology. Nevertheless, like everything, it came to an end, and we came back to Italy in 1990, and then I was actually without any special possibility of doing my job. I mean, I didn't have any special content, and there was 1 month later that I arrived to Italy, and there was an ad in the newspaper, and it was Luca Gianaroli, a name that for me was totally unknown, looking for a biologist. They didn't use the word embryologist, maybe, I don't know, I don't remember that. Anyway, I didn't even know what it was. And then so I went to see him, and since I had some publications coming from my studies in Venezuela, and I spoke a decent English, I convinced immediately that I was the right person. And this is how I started working with him. He is the one that taught me how to do IVF. I'm talking about the early days of IVF. So,
So which year was this?
1990.
1990. Yeah.
So it was conventional IVF, but I didn't have an idea, about oocyte, spermatozoa, embryos, and he taught me how to do it. He taught me how to struggle with partial zonal dissections, subzonal sperm injections, because ICSI was not there at that time. And then it was how I started, and I'm still here.
And when you think of when you became an embryologist and where you are now, was being a biologist in an IVF clinic or an embryologist, was it what you had imagined, or maybe you didn't really have any sort of expectations? How has it turned out? What's good, what's bad, what's changed during all these years?
The first day I was shocked. You know, since I don't like very much operating rooms. I mean, I don't like blood. I don't like, you know, it's something that I feel okay in the lab and not in the operating room. Maybe. So the first day it was something that I thought, no, I don't like it. But as soon as I started seeing the first oocyte, sperm, I was not really fascinated by sperm, but the first embryo, I was impressed. And then even nowadays, I still like embryos so much. And when I see a beautiful blastocyst, you know, one of those, or a morula, I like morula so much. I could spend hours looking at them. Well, hours is a little bit too much, but I mean, I really still like it. So it turned out to be a fascinating area for me almost immediately. So yes, it's something that I always say, if somebody would tell me, you have the possibility to start your life again, would you do the same? Would you change many things? And I always say I would exactly do the same, because I'm so happy with my job, with my activities, with my results. Of course, there are difficult moments, like in everything. But yes, no, I don't want to change anything in my life. That's perfect. I have good friends and good colleagues, and that's fantastic.
All over the world, yeah.
All over the world.
How did you sort of get started in ESHRE? I think we were there. We started almost a bit at the same time. So which way did you sort of come into the ESHRE part of your career, so to say?
Well, again, it was because of Luca, because he was the one that started. I think that you said he was a visionary. He's a visionary person, and maybe he could see that. Just I'm a little bit immodest. I think it was saying that I had potential to grow, to develop, and then he started to bring me to all congresses and to introduce me to the key people in our discipline. And so it is how I met all the founders. So I cannot tell all the names, because of course there are many. I would just maybe like to mention, of course, Bob Edwards. And I think that I'm also going to give a thought of Jacques Cohen. One of the things that I learned from Luca was how to become fond of ESHRE. And being ESHRE for him was top priority. And I started to follow him and to be involved in the society. My first real commitment was in Berlin. I still remember the place and the room. It was in a pre-congress course of the special interest group embryology. There was a debate between Stratis Kolibianakis and David Gardner on blastocyst transfer that was, my goodness, it was hot. They were, it was an unbelievable debate. But nevertheless, during the coffee break, Dominique Royer, that was the coordinator of the embryology at that time, went to Luca, not to me, to Luca, and said, do you mind if I ask Cristina, your embryologist, to join the group? I mean, come on, ask me, not first. But nevertheless, then he said, of course, yes, yes, yes. And it was, I started to be a real embryologist. I mean, because I have to say that belonging to the SIG embryology changed my life completely. It was a fantastic experience. And when I was, when I became the coordinator of the SIG embryology, I mean, I was really flying high in the sky. It was something that I really enjoyed. We worked very hard, you know, because we were together in the steering committee. we worked really hard in the certification scheme, in promoting education. And we reached a point that I'm very, very proud of. Before my time as coordinator, the special interest group endocrinology was the most popular. And during my time, we overtook them. And now we are the most popular SIG, or special interest group. And this was something really exciting. And then, duty after duty, we came to a day in which it was a November meeting, in one of those internal ESHRE meetings. I was in a corridor of the hotel where we were having the meeting, and you, that were the chair at the time, approached me and asked me, I would like to propose you as a chair-elect of ESHRE. Would you like to accept? Of course, my reaction was to say, okay, I have to talk to my boss, because of course it's a timing implication that is very important, so I have to talk to him. But believe me, I was I was jumping like a kangaroo. I was so excited, was so happy, although I was totally sure that it was not going to be possible, because I thought, you know, two Italians coming from the same city and from the same center, very difficult to happen. But then it was, I think that people in ESHRE didn't consider that this was a negative point, and at the end I was appointed, and now I became chair of the society. That is a tremendous honor. I mean, something that if I think of the names that were before me, and I can still believe that this happened. We have that fantastic role that I think it's one of the winning points in our society, of having this alternation as chairperson between clinicians and scientists. And I think this is such a strong message given, because our discipline is the real demonstration or example of a close collaboration. We cannot exist without clinicians, but clinicians cannot exist without scientists. So I think that this is something that really reflected how ESHRE was created, but resulted to be at the end the real extra point in advantage to our society compared to many others. So yeah.
Okay, thank you so much, Cristina, for this. Excellent, great. And I do hope that we will soon meet in real life. I miss you.
Certainly, we will meet in the virtual annual meeting of ESHRE.
Yeah, but that's not the real life.
It's not the real life.
It will be almost like real life, we hope.
But it is the reality.
Yes, it is a reality, absolutely.
Yeah. So I hope to see everybody there, because it has been a difficult decision to make this change. But as I thought from the beginning, we have two possibilities. Either we stay here in full depression, thinking, oh my goodness, what happened to me? Why to me? Why to me? Why now? Or we react and we take the bull by the horns and start try to find a way out. And this is what we decided to do. So I think that we will be in the winning part of the situation. So this will be a very good meeting. Then of course, I really miss you all. I really would like to sit next to you and you know, drink a glass of wine. Can I say that?
That will be for next time.
Glass of wine. That is very healthy. It's a Mediterranean diet, so that's good. So I really miss you all. I hope that we can meet very soon. In the very near future.
So good luck with our annual virtual meeting. It will be very, very interesting. Very interesting.
It will be.
I heard a lot of people registered already, so great.
Yes, that's great.
Okay, take care. Thank you.
Bye.
Very, very nice. Thank you so much, both of you. And I was prompted to say that. Thank you, Thomas. You have to cut out all the bad language and poor jokes of both these ladies, and especially for removing all the good things that Jacques had to say about the ASRM. We do need to keep some balance here, don't we? No, really. ASRM and ESHRE are two groups that are working very well together, I have to say, and which is very important to our field. You agree, Jacques? Yes?
Yeah, of course. I remember best of ASRM and ESHRE, just excellent meetings, and I haven't seen one for the last year, I think. But yeah, no, really great. And thank you for these interviews. Wonderful. We are ready to look at your questions, audience. Behind the scenes, we have our wonderful I3 teams, including Thomas Elliott, Marianne Severic, Shasta Druden, and Peter Nash. As well as today, we have Kelly Catterson and Charles Palmer, who have sorted your questions and looked at that. And so for any disclosures and bios of speakers and moderators, you can go to our site and you look up the 19th session. So, well, Kersti, go ahead.
Yeah, we have a number of questions here, but first I would really like also to, because I've been looking at the chat as well, and I think it's a wonderful chat. And thank you ladies for sharing with us these exciting moments, fascinating interviews, what a nice journey, motivational, inspiring, wonderful. So I really, again, thank you, Cristina and Catherine, for sharing with us all this that you did in all these fantastic times. So if we go to the questions, we have a number of questions for, I think I would like actually to start with one for both of you, because there's several questions here posed as from female embryologists. How do I go about if I want to, you know, come to where you are, or at least to go forward in my field, being a female embryologist? If each of you could pose a short sort of advice, what would you give them, please? Catherine, can you start?
Sure. So first of all, I don't think being female or male is an issue. I think it's the person behind the person that will take you where you want to be. I do think it's very important to try to find a good mentor, somebody that you can look up to, that you can trust to give you advice when you're trying to make difficult decisions. I think all of we older people would certainly not be where we are. I wouldn't be where I was at all if I hadn't had fantastic mentors along the way. So I think finding somebody who you can really look up to and help get advice from is very important. Also, you know, get involved. And we've talked about the ASRM and we've talked about ESHRE. These are organizations that are really certainly welcoming the younger generation. I can certainly speak for the ASRM in this regard. We really want young members. The younger people are the life of the organization in the future. And we as an organization are doing everything we can to try to help and encourage younger people to get involved at all sorts of different levels. So Cristina.
Yeah, well, enthusiasm, I think it's the first thing that I would like to transmit to young people. When you receive somebody in your lab, extremely important to transmit this special feeling that we have for our profession, because this is the thing that I was feeling when looking at your interview. This was transpiration of enthusiasm from every single cell of your body. So this is something that should, I think, motivate young people to be attracted in our field. And yes, you're totally right. I think that in ESHRE we do the same. We have created, we have given a lot of room to young people. We have created the so-called Young Talent Group. They have so many ideas. They are so good technically speaking. They have such a different perspective compared to us in terms of communication. They are fantastic. Of course, it's a different way of communicating probably compared to ours, but I think that this is an unbelievable change. So my message to young people is absolutely come, join us. And if you are a female, there is nobody preventing you. Look at the example here. I mean, the two presidents of the two biggest societies of reproductive medicine are female. So no, it's, I mean, the field is open for all of you.
Absolutely, absolutely. And you actually touched a chord with respect to sort of the enthusiasm. So one of the things that I'm worried about in our field, frankly, is having people work in the lab who don't have the enthusiasm, who are just there because the pay is good, it's a stable job, and you can work by a protocol and take the eggs after retrieval and leave them for a certain amount of time and then inseminate them and go through all the steps. But you've got to have that love of what you're doing. It is absolutely amazing what we do. We're making embryos that make humans. And that is just such, to me anyway, it's an incredible responsibility, but just such an incredible privilege as well to be in this situation. So I couldn't agree with you more, Cristina. Enthusiasm and understanding what you're doing. Don't just do what you do, but really understand the biology. And if you haven't had the training, find somebody who can help you get the training, give you the knowledge so that you can pass that along as well. Because that's really the only way that our field is going to continue to flourish, I think, is to continue to have people in it who really do understand the biology, as well as have excellent hand-eye coordination. Don't you think that's really, really important?
Oh, yeah, absolutely. This is why we created our program of certification. I mean, our program of certification for embryologists is not to recognize their skill. This is something that it is to their clinics or to the place where they work or to their laboratories. They of course, they are recognized there. But what we want is them to demonstrate that they know the biology, they study the biology. So it's not simply doing, if we talk about clinical embryology, is not simply putting sperm and eggs together. It's much beyond that. And well, if we can convince, and not everybody, because you're right, there is a tendency for nowadays to be the way that you described. I mean, finish your working hours and then going home, not staying there, maybe reading papers and trying to understand, making some sort of research or whatever. It's true, but if we can convince at least a few of them, because we can transmit our enthusiasm, and then I think we made a good job. So it's still worthwhile to try to do so.
Yeah, absolutely. And of course, I mean, one of the major, I think, opportunities that our field still has to offer is there are so many unknowns still. So for anyone who's listening to this discussion today, as you're working in the lab, allow yourself to think about the what ifs and the whys, and then find somebody who can help you answer those what ifs and those whys, because that is how the field is going to continue to advance. And it's advanced hugely since the birth of Louise Brown, since 1978. My gosh, how is it? She's going to be 43 this year, which is amazing. But 43, 42, I can't do my math. But anyway, we've done a lot. We've moved the field forward tremendously, but there's still a huge amount that we need to do and can do. And yeah, the opportunities are there. Just find somebody to help you along the way.
Yeah,
that was excellent. Thank
very
you.
Long answers to a short question.
Yeah, yes. Thank you so much, both. You can all tell the enthusiasm of these two persons, absolutely. And I do agree, that's what you need to go forward. I have a totally different question, very, very different, because I mean, I'm thinking now mainly the moderators, me and Jacques and Cristina and Catherine, we are in countries where we can provide all these things, but we have a question here of, do you have any projects to help developing countries? And it doesn't say anything more. I imagine it's about, how can we help these countries to set up their own schemes for providing? What can we do to help them? Can we, with education and with the laboratory stuff, of course, and everything? Do you have any, maybe a little bit short answers to these?
No, okay, I'll try to give a short answer. So I've actually been involved, along with Selwyn Oskowitz and others, in building an IVF program in Rwanda, in Kigali, in the Rwanda Military Hospital. And that experience has taught me a lot as to how one should start to go about helping to set up a program. The biggest, I think the biggest and most important thing that one has to have in place in order to do this is a group of people who really want it. They want to own it. They want it to be theirs. They're willing to work really hard and to learn, because the idea here is not for, you know, someone who's completely trained and skilled to fly in every so often and do a batch of cycles, but for them to be a free standalone clinic. So I'm doing this work in Rwanda with others. There are many people around the world I know who are also helping to set up programs in one area or another. But again, I think probably the most important thing is to have people on both sides who are really enthusiastic and really believe that this can be done, despite all the challenges. And there are many, many challenges that one faces when trying to do this. We take so much for granted in the Western world that just is not there in these developing and underdeveloped countries. So it's tricky, but you've just got to, again, you've got to have the enthusiasm, you've got to have the will, and you've got to have the belief. Then I think you're on the way.
So in other words, the effort is there, but it always comes from individuals rather than organizations or hospitals or universities, right? It's really an individual enterprise. I mean, I've heard of several examples over the years, but you're quite right pointing out that you need to come forward. If you have this initiative and you are somewhere in Africa or South America or somewhere in Asia where people can't afford this, you need to come forward and let people know, and just go around the list. The list is long. We have the internet to access people. The list is long, and I think you'll get people together to help you out. But yeah, you do have to come forward and be specific about the plan.
Absolutely. I mean, I would say though, Jacques, and I certainly don't want to monopolize the conversation, but I think it is important also, if you can, to get some sort of an organization behind you. So we have the Rwanda Military Hospital behind us to help. They provided the land and the building for us. They're there, if we need liquid nitrogen, they have a way of getting liquid nitrogen into the facility. So it's a very complicated sort of multi-dimensional project to get an IVF program set up in one of these areas.
So question for both of you, going back to the previous topic, which is so important, because all this enthusiasm and this delight and this warmness we have for this field that's so expressed by the two of you and by Kersti. Helen Priddle from Cardiff is asking both of you, how about the ratio of women embryologists versus the women lab directors and other positions of authority? Whereas somebody else mentions 4 out of 5 embryologists are women. I think that's well accepted. I think that's the same ratio now as starting REIs and gynecologists. But levels of authority, like the two of you have now, where that ratio is not 4 out of 5. So how is that going to change? What can be done?
Cristina, do you want to tackle that first?
Yeah, well, I don't know exactly how the ratio is at that level, but that for sure things are changing. So maybe it's not 4 out of 5, but if it's not half, we are very close to it. So, and I think it will be the other way around in the near future. This is the experience that I feel that I have, the great majority, the majority of key positions in our field, lab director and so on, are more and more occupied by women. So
it's my observation too. I don't have the hard data to go with that, but that certainly is an observation that it's close to 50-50, and that there's no, I do not see an inhibition there. I don't see anything perfectly in place, and I hope that I'm not naive and wrong about it, but I don't think the barriers are there. It's just taken longer for the levels of authority to go 50-50 and to go to the same ratio as you see among technicians and clinical embryologists. Alison Bartolucci from Connecticut is asking, thank you for sharing your stories. What are the most important topics that you feel you can uniquely address, specifically as embryologists? Alison is a lab director and embryologist in these top leadership roles. So,
Alison, if I may, so Alison, hi. So Alison actually begun life in my lab. She was actually, I think, if I'm correct, I think she was pre-vet at the time and fell in love with embryology in my lab. And I'm just so proud of you, Alison. She has 3 children and she got her PhD and she's now the lab director.
2 weeks ago, that's right.
Yeah, which is great. So what are the, so I think your question was, what are the important things that we need to be concerned about? Is that basically the gist of what she asked?
Yeah.
I was just so excited that it was Alison who asked the question.
So what are the most important topics that you feel you can uniquely address as embryologists in these top leadership roles? So as an embryologist, the 2 of you,
yeah.
How do you address your, I mean, you have to, of course, cover a reproductive urologist, a gynecologist, you have to cover psychologists, social workers. You have to, as a leader in that role, you have all those professions to deal with, including the stats guys and the researchers, obviously. So how is there anything in your own profession that you can carry on and apply to what you see? Anything that you can improve in your own profession because of the role you have right now?
Wow. So I think, I mean, from my perspective, it's not so much the type of person and the profession, but more the topic. So, I mean, one of the things before COVID that everyone was so concerned about was, of course, germline gene editing. And this is, I think, an area that we cannot ignore. I mean, this is, the IVF process is required in order to do germline gene editing. And there's this very close interface and interdigitation between the science of it and what we do. And so this is perhaps one of the things that sort of bubbles in my mind constantly as I think about the big challenges in our field going forward after the COVID, if COVID-19 ever goes away, or novel coronavirus pandemic ever goes away. I don't know, Cristina, what do you think?
Well, yeah, certainly this is something that is upon our heads. It's coming more and more. And I wouldn't forget the issue of epigenetics. You know, I mean, this is something that comes and go as a concept, as a concern. Nevertheless, we never have to forget that we are creating a totally artificial environment. We are trying to do our best to have the best result possible, but sometimes maybe we should pay a little bit more of attention to the fact that the best is not having more blastocysts, maybe more faster growing blastocysts, having more and more pregnancies. Maybe the key points still remain to us, the baby born. I mean, the health of a baby born. So all the epigenetic concerns are still something that are worrying to me. Certainly, yes, I would say that. Yeah.
Yeah, and that so it's one little step at a time. And sometimes there have been leaps like ICSI and IVF itself, which of course nobody knew before IVF what the consequences were for mouse babies. They looked okay, and that's all we actually knew. They looked okay. So the preclinical research wasn't there. Now it is there, or at least better defined. And it's one very small step at a time. I mean, it's very tricky that we don't see outcomes for many, many years. So,
and we need the numbers in order to be able to determine whether we are doing any harm with any of the interventions. You need thousands of cases to be able to see whether there's any increase over background.
Yeah, and there's also, of course, the issue that, and I don't want to take any words away here, but there is the issue that the patients are changing too. They're getting older, both the men are getting older and the women. And it's mostly on the men now that we see those spontaneous genetic mutations, that they are a major cause of that. Of course, these are rare diseases, fortunately, but they still occur. And because of assisted reproduction, they may be occurring, again, with very little data. They may be occurring more frequently because men are getting older going through these procedures. And so I think the concerns on multiple levels.
Absolutely. And then, of course, there's the environment as well, which we mustn't forget, and the issue of weight, which is another issue, and diet. I mean, we can just go on and on. But I think it really, doesn't it, Cristina, sort of point to the need for our societies to be thinking more about data collection and registries to follow children in the long term. And you and I know all the challenges and issues with that. But as a field, we've not been very good about collecting long-term data. We've been very good at collecting immediate data, as you said, getting pregnancies, getting isoblasts, getting pregnancies, getting live-born, recording our data by deliveries, and programs feeling good if their delivery rate is X% higher than the program down the road. But there's a much bigger, much more global issue that we need to be, I think, a little bit more thoughtful about.
Yeah, so about data collection, how is that now? Of course, in Europe, it's so much more difficult because, Cristina, you're overseeing something like 25 or 30 countries, whereas Catherine has it a little easier. She's overseeing 50 states.
I was going to say.
There are differences in laws in different states, but it's still there's common factors. So with this pandemic going on, there's a lot of data being generated, a lot that we know from the literature now, not necessarily in our field, but in literature in general, is generated so fast that there are many, many mistakes and many poor papers. And there's been publications, there are publications in the last months that this is an epidemic of poor papers. But we have the chance here to collect data at the start of this pandemic, during the pandemic, and then later. And so in Europe, how do you deal with that? How do you, I mean, we have SART-CoRS, and of course the UK has HRVA that's collecting data, and that's data probably collected in other countries too, but it's sort of sporadic and not really. I mean, Sweden is a different story. Their data is collected nationally and has been long before IVF. But how is this done in European countries? Well,
I think that the great majority of countries organized the national data collection of that. I mean, we received in Italy the request to collect the data exactly on this time. And in ESHRE, what we are doing is the same. There is a platform on our website in which all pregnancies, we request everybody to report pregnancies and treatment of patients during this period, with special reference to those that were COVID positive, of course. So the data are coming in, and we hope to put them together. As you said, I mean, in this situation, we have a terrific opportunity. We cannot miss this opportunity of following up what is going on. And the collaboration between the two societies, and it's extremely important. Also the other scientific societies. We have a great example, maybe Catherine, I leave you the word for that, of great collaboration between ASRM, ESHRE, and IFFS in this respect. So I think you have to mention this because it's really important thing that
the data has to be collected. And, of course, it can be, once you keep the data, it can be retrospectively collected too.
Sure.
Right. Yes. So Cristina just mentioned the collaboration between the three organizations, ASRM, ESHRE, and IFFS. So we've actually just written a joint statement of the position of the three organizations together on COVID-19 and the management of patients. And I'm really excited about this. I think it's really been an opportunity for us to come together as the three leading organizations and really, make a statement that actually has demonstrates to the policymakers and to the world that we stand unified in these very, very serious issues in terms of managing patients in this setting. So, but again, I think that we have an opportunity here, Cristina, ESHRE and ASRM, to really try to pull the data together with respect to the collection in registries regarding COVID-19. So some causes increase, they've expanded the fields in order to capture information on COVID. But in addition to that, at UCSF, Marcel Cedars has set up a study called ASPIRE, where we're collecting prospectively data.
Yeah.
So little by little, but it's going to take a long time.
Kersti, over to you.
I was looking again at the questions here. If we can, do we have some more minutes? Yeah.
Oh yeah, sure. Yeah. If it's okay with everybody, yeah. Let's.
Yeah. I have two things that I thought would be really interesting to ask you while we have you both here, and one is about the status of embryologists. Is it improving or declining? And what are these perspectives for embryologists in the future? I'm thinking, for example, what about the automatization of the labs? Will we just be sitting there, you know, drinking our coffee and looking at what's through a screen? And the other question, which I would like you to answer with just one answer, is from Ghulam Bahadur. He says, well, he or she says, well done both. What privilege to have had hands-on experience on so many changes in reproductive medicine. Which single change throughout the years was most memorable to you? So one question about which single change, and the other one, what about the future of the embryologist? What do you see in the future? So who wants to go first?
Well,
so why don't we each tackle one of them? Okay.
So you start, Katrina. Okay.
You can have one each. If you want.
All right. I'll tackle the single biggest change. So honestly, I mean, I think, gosh, there are so many.
Yeah.
I mean,
yeah.
I think probably most people are thinking ICSI, which certainly was an absolute game changer in the field, but that's sort of now passé. Perhaps honestly, the single biggest changer is our understanding of the culture environment as a whole, and what improvements in the culture environment have been made in order to enhance embryo development. And I'm talking here specifically about our understanding of low oxygen tension, although I will add that Bob Edwards cultured Louise Brown's embryo in what we refer to as low oxygen tension. It was the 5590 mix, trimix. But I mean, there have been some other key advances as well, for example, in the culture media development, which clearly have, I think, been very helpful in moving the field forward. But there are many different contributions of one sort or another that together have really allowed us to move the field to the point where we now can, with confidence, culture embryos out to the blastocyst stage. Whether it's the right thing to do or not, getting back to Christina's comment on epigenetics, is another whole question. Should we be taking the embryos, getting them fertilized and putting them straight back into the tube and do Zift? Of course, there are worries there about not getting pregnancies, and there are issues. But yeah, there are lots of complicated advancements, but I would say probably just a better understanding of the culture environment has been the biggest step forward, I would say.
Oh, okay. Great. Cristina?
Yeah. Well, yeah, of course, I agree. Useless to say that. I would also mention the concept, sounds a little bit boring, but I think it's important, of quality. I mean, we have been learned how to work under strict quality control that is not only a matter of security for the cultures, but also for the patients, you know, the witnessing systems. I mean, they are of great importance. I would also mention oocyte and embryo biopsy. Why not? I love them. I love both techniques. And I think that if we skip the matter, because no discussion here of chromosomes, but if we speak about the possibility of testing for genetic disorders in couples at risk of affected offspring, this is a tremendous advance. But one thing I have to mention, thinking of what Katrina was saying about doing the micropipettes. What a nightmare, holding ICSI. And, you know, but this is nothing doing them that, as Katrina was saying, we spent the whole day doing them But then having the person that in my case was Luca Gennaroli sitting on the microscope and doing the subzonal sperm injection at that time and throwing one after the other the pipettes that took hours to me to do. So thank God there was somebody coming having the idea of making companies that they are now commercially available, and we are, well, safe from that night.
I went once to one of those factories where they make these pipettes. It's amazing, these robots picking them up, looking at them, you know, discarding or not. They do these completely robotized, strange stuff, do exactly what we did with so much labor. Yeah. And what about the future of
the status of the embryologist?
Here in the future, or will we be changed?
Well, I mean, I actually think there's always going to be a place for the human eye. I think the human eye can discern things that machines will never be able to discern. So I do think that embryologists are always going to have a job. How the intervention of the automation is going to interdigitate with the human intervention is another whole question itself. But I certainly think that because we know every egg is different from every other egg, every sperm sample is different from every other sperm sample. I would be surprised if the work of the embryologist is completely replaced by automation. In fact, I'm going to be debating that at your meeting, Cristina.
No, I totally agree. I totally agree. I mean, it's, of course, things will change. They change a lot from the past. They will keep changing. More robots doing some part of the work. Artificial intelligence interpreting a lot of data that, of course, we cannot do ourselves. But at the end of the story, there will be always our brain over there elaborating the data, drawing conclusions, making connections. So I don't see any other possibility. So I don't believe that in 10 years from now, instead of Catherine and Cristina sitting here, there will be two robots.
R2D2.
I really doubt that.
It will be called sperm and egg.
So I totally agree with you.
It's fine.
Okay. The funny thing is this debate has been going on now a little bit and we have a lot more questions, but I think we're at 4:15 Eastern time. These questions we're going to send to you, you're going to answer them, hopefully. And then don't put them on the web. Kersti, if you like to say a few more things, and then thank you. Then we'll close it up. So yeah, Kersti, if you.
Yeah. Okay. Thank you both for this. Was fantastic. Really, really amazing. And for everybody else, we were up around somewhere 365 attendees, I think. Thank you so much for taking your time to attend and participate. And there were so many nice comments on the chat. Wow, that was fantastic. So thank you so much again. And especially, of course, our two leaders, Cristina and Catherine, again. It was a pleasure. So, you know, looking at things like these, it always looks so easy to put together. But as always, there is a tremendous amount of work that goes on behind the scenes to pull this off. So Jacques has already mentioned the organizing committee of this initiative. It's Jacques himself, of course, Peter Nudge, and technical director Thomas Elliott, Shai Sadruddin, and Marianne Shevech. And none of these individuals are, of course, slowing down, as none of us are at all, during this international breaking activity. If we cannot do our IVF, we do something else, of course. And also, I have to say that behind the scenes today, there were Kelly Ketterson and Giles Palmer as well. So I think it's time to conclude, and I know that Jacques will tell you some last words of what's happening next. And again, thank you so much. It's now almost 10:30 here in Sweden, so up early tomorrow, and there will be a glass of wine and a pillow very soon for me. Great seeing you. Take care, everybody.
I just have a few more things to add to this. Our next session is on June the 9th. That's exactly a week from now. And it will be organized, Cristina, I hope you'll attend, because it will be organized by ESHRE, I hope I pronounced this right, S-I-E-R-R, that's the Italian Reproductive Biology Society, and they will organize a session on the future of embryology. And this will be chaired first by the president of ESHRE, it's Lucia De Santis, and the speakers are Marcus Messiger and Maurizio Poli. And the moderators are Francesca Klinger, Danilo Cimadomo, I'm sorry if I don't pronounce this right, Catello Schiraca, and Antonio Cobalbo. I know his name a little bit. So that will be June the 9th. Well, again, thank you, everybody. Also, Kersti, thank you for moderating this. It's really been a fantastic experience. Thank you, Cristina and Catherine. But before I sign off, I like to say, these are just extraordinarily hard times, particularly in our country today, but of course in other countries as well. Today we interviewed models of leadership. We long for such guidance and leadership in the world. We hope that our webinars and initiative and those of others offer a reprieve from disease and fear. Remember, all sessions and interviews can be streamed from Netflix. No, not Netflix. YouTube. YouTube. They can be streamed from YouTube and our website, ivfmeetings.com. A little less exciting. Maybe one day Netflix, but not today. So see you all next week. Take a deep breath every day. And please be very, very safe. Thank you very much.
Thank you.
Bye-bye. Take care, everyone.
Thank you so much.
Bye-bye.
Bye-bye.